Morning. Morning, Beatrice. Morning, Colin.
Yeah. I'm here.
How are we today? Morning, Sabina.
Morning. All
right, I'm gonna get this session started because we've got a bit to get through today. For the equipment, what you guys will need is 2 dumbbells, so it's just some weights, and a small ball. So if you have a small ball, I know Sabina's thinking. So how we start these EVO classes, guys, is we're adding in a bit more of an education factor at the start. So I'm going to do a bit of talking. So if you want to have a seat, Beatrice, make yourself comfy. All right. So this week, we're on topic 4, and that's just in regards to falls and balance. All right. So I'm just going to give you a bit of education. If you have any questions, please yell out to me, but we'll just get through this and hopefully it'll make sense. All right. So osteoporosis is a disease where the bones gradually become weak and brittle, and that's associated with aging, and it can result in broken bones or fractures, especially of the hip, wrist and spine. They're the ones that we see most often, especially in the clinic when we get new patients in. It is also known as the silent disease, and it can occur without any noticeable symptoms, so it's hard to detect it. So that's why we're doing a bit of this education, just to make you guys aware. You can tell your friends, you can spread the awareness. Unless you have that bone mineral density scan, or sometimes it's called a DEXA scan, to determine your health of your bones, it's impossible to know how healthy your bones are. So that's why we encourage getting those bone scans. It is estimated that there's 1 in 3 women and 1 in 5 men over the age of 50 who will develop osteoporosis. And other than the age, causes of osteoporosis can include, does anyone know any causes? Any things that can cause osteoporosis, so weak mineral bone density?
Lack of calcium.
Yes, lack of calcium. Beatrice, Colin, do you guys know anything?
Only exercises.
Yeah. So other factors that can cause osteoporosis can include things like menopause, so that's women only, long-term use of certain medications. It can become a side effect, low bone mineral density. Certain medical conditions such as like kidney failure, diseases of the thyroid or adrenal gland, rheumatoid arthritis, symptoms like that. Some diet, so reduced calcium, like Sabina said, reduced vitamin D, vitamin A and K, and magnesium, and also alcoholism. Alrighty, so it is now generally believed that the attainment of optimal peak bone mass is important in reducing the risk of developing osteoporosis in later life. So it's thought that bone mineral density peaks around the age of 30. So before 30, what we do in our childhood will affect us later in life. So that's why it's so important to get your grandkids, to get your kids into as much exercise, as much bone loading exercise. So do we know some exercises that are good for loading our bones and some exercises that are bad? Can we think of any of those ones?
No, I thought all exercise was good.
Yeah, I thought all exercise was good.
Well, I'll give you an example of something that's bad. So swimming actually decreases our bone mineral density because we're in water, because there's no weight to that movement, because we're so light in the water. We're not actually loading our bones with anything. So something like running, jumping, those movements where we're loading the bones, that will increase our bone mineral density. That makes our bones stronger. Things like swimming decreases our bone mineral density. So that's something to keep in mind. So I was a swimmer and I stopped. No, I still swim now, but I also make sure that I include other physical activity into my schedule. So for example, I do touch footy and I do netball as well as swimming. So I'm still loading my bones, and swimming still has great benefits for other factors. All right. So in regards to exercise and osteoporosis, the main goals of an exercise program, so what we're doing today is just to prevent, manage or treat osteoporosis, to maintain or improve bone mineral density through either weight-bearing activities, so walking, stair climbing, or high-impact exercise, so jumping, bounding, stepping, stomping. And we can also do progressive resistance training, and that's just exercises to improve muscular strength, the weighted exercises with dumbbells, things like that. Another main goal is to reduce fracture risk by preventing falls through balance training. So that's why we're always incorporating a bit of balance into our exercises. So today we'll be focusing on high impact and balance training. So do you guys have any questions before we get started?
No.
Right. You're just too keen to get started, aren't you, Colin?
Yeah, definitely. Yes.
All right. Thanks for bearing with me. So exercises, make sure you have a chair, 2 dumbbells and a soft ball, or remember last week how we were doing some balance and we needed something soft to throw between our hands? Colin, not a dumbbell.
I was going to ask you, is it a Pilates ball that we should get, a soft, and what size? I was looking at them, but I wasn't sure.
So I've got this little ball. It can be any size from, obviously the smaller it is, the more difficult it will be. The ball is in relation to some balance exercises. So just passing it around our body, throwing it up and catching it, things like that. So it can be really any size. The bigger it is, the easier it's going to be. But just something soft. So you could even get just a little plush toy.
My football.
I know, I thought you'd bring the football again. Right, so if you guys have that equipment around or something, Beatrice and Colin, are you guys all right for equipment?
Yeah, we haven't got a big ball, but that's all right. We'll work on it. All
right, we'll brainstorm as we go along, all right? So if you guys want to stand up, we'll get started with our warm-up.
I saw some soft ones that there's a hard one there. Previously she had level sport and we didn't last time.
The technical difficulties. All right. Just getting set up.
Okay.
All right.
She was flashing a bit before too.
I will have a look at something else that I just noticed when I was setting it up. I thought, oh, I might try that and see if that sets it up through that.
All right, so our first exercise, we're just going to start off breathing, doing our breathing exercise. So big breath in, reach your hands up. Big breath in, arms all the way up. At the top, big breath out. And we're just going to do this for a few rounds. So big breath in, reaching up to the sky, and big breath out. Good. And again. So what we're doing at the moment is becoming aware of our breath. And we're putting it in sync with some movements. Good. Keep going there, guys. I'm just going to spotlight my video. So do a few more for me. All right, keep going. One more.
Talking about the electrical.
All right. While we're doing that, can we go into our thoracic rotations? Arms across, looking over your left shoulder, back to the middle, looking over your right shoulder, back to the middle, and we're going to do this a few times each side. Each time, see if you can get a bit further. So try to look over your shoulder. Once more. All right, from there, can we do some walking on the spot, just warming up our lower body, getting our body nice and loose, walking on the spot. Good, keep going. All right. All right, from there, we're gonna go into our high knees. So getting those knees up as high as you can. So warming up our lower body. You can have your hands on your hips if you want. All right, can we go into our butt flips? So now we're stretching out the back of our thighs, so our hamstrings, so flicking over to the butt. All right, we're going to do some heel taps. So this is just a tap in front of your heel. So tapping in front. Good, and as I'm doing it, I'm seeing if I can bend, small bend in my knee as I go along. All right, from there, we're going to do step forward into a squat, step back into a squat. So 2 steps forward, the squat. Great, guys. Once more, stepping forward, stepping back. All right, from there, we're going to go into our arm circles. So with your arms going forwards, small circles going into your bigger circles. So all these movements, guys, we're going to be working through a pain-free range of motion. So making sure that movements that you're doing don't cause you any pain. So just working within your limits, see if you can go backwards. Good. Make those circles smaller and smaller as you go on. All right, from there, we're going to go into our twist side to side. So I'm letting my arms hang loose. I'm just twisting my body. As I twist, my heel comes up on each side. Good, guys. 2 more here. All right, can we do, from there, guys, we've finished the warm up, so we're going to go into our first circuit. We have balance. So we're going to do, like what we did last week, our static balance. So stationary, focusing on our control. And then we're going to go into dynamic balance, which is more moving and balancing at the same time, all right? So for this first exercise, all right, all you'll need is your chair and your soft ball or soft piece of equipment. So I've got my chair next to me. All right, so this is the one where we have 4 levels, and I'm going to show you the 4 levels of stairs. You're going to choose the level that suits you best, and we're going to see how we go with balance. So our first one is, see if you can see my feet, but feet together. So that's our first level of balance. And then what we do is we add in side to side. All right, our second level is semi-tendon, so feet slightly apart. So 1 foot slightly in front of the other, still touching. And then we're seeing if we can pass an object side to side in our hands. All right, our third level is heel to toe, 1 foot in front of the other. So I've got my chair if I need to. I'll just turn on the side because you might be able to see my feet better. So I've got 1 foot in front of the other, I've got the wall here. Seeing if you can pass that wall side to side. All right, and then our 4th level is our single leg. So lifting 1 leg up and multitasking by passing an object side to side. All right, so I want you to choose one of those 4 stances and we're going to hold that for 30 seconds. So we're just going to do it stationary with no objects. So we're just going to hold our position and then we'll start adding in things like balls. All right, everyone knows what they're doing? All right, so going into your position, I'm going to do heel to toe for my first one. We're going to start in 3, 2, 1, go. So at the moment, we're just holding our balance for 30 seconds and then we're going to swap sides. So trying not to hold onto the chair, trying not to touch the wall in that stance. Good, a few more seconds, guys. Last little bit, 3, 2, 1. All right, resting there. We're going to switch sides now. So switching over. So I'm putting my left foot in front this time. We're going to go in 3, 2, 1. Let's go. Again, 30 seconds. So a few tips that I like is 1, staring at something ahead of me that's stationary. So finding a point to focus on. And making sure that I have even weight distribution between my feet. So I'm not leaning all the way forward on my toes or all the way back on my heels. I'm nice and flat in my feet. I can feel my toes and my heels evenly. A little bit more, guys. Keep going. All right, resting there. All right, so now that you've got your stance, and that was our static balance, so our stationary, I want you to grab an object, something preferably small, and we're going to start adding in some other components. So we're going to start multitasking and changing our center of gravity, which will affect our balance. So we'll see how we go, all right? So for this one, I'm going to try heel to toe again. So I'm going to get in position, and I've just got an object. I'm going to pass it side to side, okay? We're going to start in 3, 2, 1. Okay, now we start. So passing that object side to side, focusing on that point in front of you, holding your balance. To make it a little bit harder, bring that object around your body, all the way behind. Good, otherwise keep passing it side to side, so keep changing it up. I'm just going to give you a few options so you can choose which one is best for you. See if you can go the other way, pass it around both anti-clockwise and clockwise. All right, resting there, we're going to switch over. So now I'm going to do my other leg in front. All right, 3, 2, 1, let's go. Still with that object just on the other foot now, passing it either side to side, out in front, all the way around. So you're just always trying to change it up, not get into that routine. You're trying to keep it fresh. You start throwing the object side to side instead of passing it. All right, pausing there. I'm just going to unmute you guys and I want you to just give me some feedback on how you're going with your balance. All right, so Sabina, how did you go? Which position did you do?
I did the same as you, and with my ball side to side and around, and then I changed feet, and a little bit wobbly.
There's always one good side and one bad side, isn't there?
Yeah. But yeah, it was okay. I mean, I didn't have to hold on, but yeah, I was swaying a little bit.
Yeah, but you were able.
I was trying to be focused on a point, yes, and not watching what I was doing. Yep.
Yeah. How
about
about
not watching the camera?
You can't watch me. You just have to listen.
Yeah.
How about you, Beatrice and Colin? How did you guys go? I think you might still be on mute. You might have to unmute yourself, Colin. All right.
How's that?
Yep.
I'm still, my balance is still not good, Sophie, although with these exercises, it is improving.
Oh, Beatrice, I think you're too hard on yourself. We
Oh, I
all
don't-
have to start somewhere, don't we?
Yes. No, I think I'm being totally honest with you.
Oh, thank you. I appreciate that. What dance did you choose, Beatrice? Were you feet together or feet slightly apart?
Feet slightly apart.
Yeah, so that's what we call semi-tandem, but you can call it
Yes.
feet slightly apart. Did you pass an object between your hands?
No, I don't have one. I'm sorry. But
Yes, I know it's a bit of a late notice. So for Thursday, this goes for Beatrice and Colin and Sabina. See if you guys can find like a soft ball. So something like,
yeah, we will
see if
try.
you do that by Thursday, because I'll be taking the Thursday class as well.
Oh,
Colin, how did you go?
I was heel to toe, and I felt quite comfortable passing the dumbbell because I haven't got a ball.
Yeah, and at least you're not throwing it. I think last time you told me you were throwing it, and I got a bit nervous. All right, so I'm going to put you guys back on mute.
Did you see the size of it?
We're going to keep going with our exercises.
Okay.
All right. Okay. So from there, we're going to again just do one more round of our static balance. So that's whichever position that you choose, and we're going to still with this object. If you don't have an object, what I want you to do is either, so if I'm in my heel to toe, you can clap behind, clap in front. You can touch your shoulders, so like this, or you can touch your head. So you've got a few options. So whichever one you want. I'll just get the timer ready. All right, so we're going to go into our position. I'm going to try single leg this time, and I've got my object. All right, 3, 2, 1, let's go. So if you've got something to pass between your hands, you can pass it around your body. Sabina, yours is you've got quite a small object, but see how you go at throwing it? It'll be very difficult, I know. Beatrice, if you don't have anything, see if you can touch your shoulders. Good, keep going and stop there. All right, we're going to switch our legs. So, other leg this time. So I did my single leg, so I'm going to try my left leg. We're going to start in 3, 2, 1, let's go. So Beatrice, if you don't have anything, see if you can touch your shoulders, just slowly. See if you can clap in front and behind. I have to focus on this one. Good. See if you can touch your head. So arms out. Whoa. All right, resting there, guys. All right, so that was our static balance, our stationary balance. We're going to move on into some dynamics of moving exercises that will incorporate balance within it. So I'm just going to clear my space. Our first exercise that we're going to be doing. All right, I've got room now. Our first exercise is called a crab stomp. So what that looks like, I'm going to do this one on the side so you can see me. I'm going to squat down, so I'm halfway between sitting. I'm going to take a step out, side, out, together. So I'm going sideways. So what that looks like, front on, squatting down, out, together, out, together. At the start, I gave you guys some education around loading your bones. So when you do this exercise, I want you to emphasize a stomp. So we're going to stomp, together, stomp, together. All right, so we're going to do that 30 seconds. We're just going to change directions. All right, 3, 2, 1, let's go. Nice and low. Stomp, together, stomp, together. So really hard, guys. Good. Staying crouched down. So making those stomps really loud and staying in your half squat. Few more seconds, keep it going. And resting there. Shake your legs out. So that was our bone loading exercise, that helps increase our bone mineral density. So that's just an example. All right, our next exercise is nice and easy. Hands on hips. We're just going to be stomping on the spot. So while we're here, just like our marching, we're putting that emphasis onto the stomp. So we're going to start in 3, 2, 1. Let's go. Good. So making those stomps loud and stomping side to side. Few more seconds, guys. Whew, I can feel that up my legs now. All right, shake your legs out, give your body a little wrap. If you want to grab a drink of water, feel free to grab a drink of water now. All right. So now we're going to be doing some agility, so some reaction time. We're still going to be incorporating some stomping, loading up our bones. So our next exercise, give you a quick demo. We're going to be jumping side to side. So make sure you've got enough room, Beatrice and Colin, make sure you don't knock into each other. But all you're going to be doing is crouching down, going to jump side to side. And as you jump, see if you can squat down. If you don't want to jump side to side, you can always just jump up and down. So you've got 2 options here, so make sure you choose which one you want. We're going to get started. All right, 3, 2, 1, let's go. So I'm going to jump side to side. Good, keep going. So as we're jumping, make those stomps really loud. Good, keep going a little bit more. Last one. All right, resting there. Again, shake your legs out. Oh, love stomping today. All right, our next exercise will be either 360-degree turn or 180 turn. So I'll give you a quick demo. I'm just going to face this way so you can see me. We're either going to jump forwards, right, backwards, to the side. So that's one way. You can jump a full 180. Or, I don't know how this will go, but you could do a 360 turn. So you've got your 90-degree, so forwards, right, back, left, or you can do your 180-degree turn, all right? So whichever level that you want. All right, we're going to get started in 3, 2, 1, let's go. I'm going to do the 90-degree to start off with. As we're jumping, make those stomps loud. Good, keep going, guys. If you want to change direction, change direction. I was getting a little bit dizzy. Ooh, keep going, a little bit more. All right, resting there. I think we're getting that heart rate up. All right. All right, for our next exercise, guys, we're going to do a side step into a squat. side step, squat. So like our crab walks, but this time we're not stomping. All right, so make sure you have enough room. I'm going to get the timer started in 3, 2, 1, let's go. Side step, squat, side step, squat. Good, all the way down. And we're going to do this one for 30 seconds. Good, keep it going, guys, side to side. A little bit more. Side step, squat, side step, squat. All right, have a break. Grab your drink bottle, guys. We're gonna have like a minute break here, and then we're gonna go do those stomping exercises again. So have a bit of a breather. All right, we're going to go back into our crab walk with our stomp, and then we're going to go into stomping on the spot, then our spins, and then finishing off with the side step and squat. All right, so that's the first exercise, crab walk with the stomp, squatting down, stomp, together, stomp, together. All right, so I'll get the timer started. Ooh. All right, 3, 2, 1, let's go. Squat down, side, together. Make those stomps loud, and we're staying nice and low the whole time. Good. Keep it going. Keep going, a little bit more. All right, that's our 30 seconds. So shake your legs out. All right, we're going to go into stomping on the spot. So hands on hips. We're going to start the clock now. Make those stomps loud. Good, keep going as hard as you can. So we're going to do all these exercises for 30 seconds, and then we're going to go into our next circuit. All right, stopping there, shake your legs out. Our next exercise is the jumping exercise. So if you're doing 90 degrees, or if you're doing the 181, all right? So make sure you've got enough room. We're going to get started in 3, 2, 1, let's go. So I'm just doing the 90-degree one, side to side. See if you can turn the other way. Ooh. Keep going, guys. Keep going. You got your last few seconds. All right, stopping there. Shake your legs out. Get that good juices flowing. Okay. And then our final exercise is the step, squat, step, squat. All right, so we're going to do that one in 3, 2, 1. Let's go. Step, squat, step, squat. So trying to get nice and low with your squat, and we're kicking our shoulders back and our back nice and straight. Good. Keep going. Looks great, guys. Few more seconds. All right. Shake your legs out, grab yourselves a drink, and then we'll go into our next circuit, so with some new exercises. So have a quick drink of water. All right, so we've got 2 exercises and then we're going to do our cool down stretches. So our first exercise, you'll need a chair and 1 dumbbell. So just 1 dumbbell for me. Again, this exercise has 2 variations. So I'm going to show you one, then I'm going to show you the other one, and I want you to choose which one is best for you. First one you can do no dumbbell. Holding onto the chair, we're doing our arabesque. So one leg goes behind and I bend at the hips. So this is the movement. Bending at the hips, keeping a nice straight back. So that's level 1. To make it a bit harder, grab your dumbbell in your free hand. Have it next to you so it adds a bit of weight. So that dumbbell's going to go down my leg, back up. All right, so my leg still goes back. I'm just adding that bit of weight. To make this one harder again, adding in that bit of balance, hand off, and we just have our hand on our hip and see how our balance goes. Doing this one leg variation. So you've got 3 different options there, guys. I want you to choose the one that suits you. All right, we're going to do 30 seconds on one leg, 30 seconds on the other leg. So I'm going to start holding onto the chair. We're going to go in 3, 2, 1. Let's go. So with this one, take it nice and slow, nice and controlled. Focusing on getting that leg back, keeping a nice straight back. So what we're doing now is we're stretching out and exercising our hamstrings. So the back of our thigh, you should feel a nice stretch when you go down. All right, we're going to switch legs now. So because I'm holding the dumbbell, I'm just going to move my chair. All right, so getting ready for your other leg. We're going to go in 3, 2, 1. Let's go. Good, guys. So taking your time here. Shoulders back, making sure you have a nice straight back. And just going down as far as you feel comfortable. Good, a few more seconds. All right, stopping there. So I'm going to put my weight away now. Our next exercise that we're going to go into is our calf raises. So I'm just going to move the camera so you can see my feet. So again, you can do this one hands on hips, going up onto your toes. If you want to hold onto that chair just for a bit of stability, you can hold onto the chair, right? So we're going to do this one for 30 seconds. 3, 2, 1, let's go. I want you to go fast on the way up, and we're going to do 1, 2 seconds on the way down. So nice and slow on the way down. Fast on the way up, 1, 2 on the way down. 1, 2 seconds. Up, 1, 2. So slowing it down. That looks great, guys. Keep going. Few more seconds. All right, resting there. So those are our 2 exercises. We're going to go back to the arabesques. So the first one that we just did. So again, I'm going to grab my dumbbell and we're going to get started with this. All right, we're going to go in 3, 2, 1. Let's go. So we're going to do this one more time, guys. So this is our last time. And then we're going to go into our stretches. Good. So focusing on pushing that leg behind you, standing up nice and tall. All right, switching legs. So I'm going to just move my chair. We're going to switch our legs over. We're going to start in 3, 2, 1. Let's go. Other leg. Ooh. So take your time with this one. Testing your balance. Few more here. Last one. Done. Putting your weights away. We're going to go straight into our calf raises. So if you need the chair holding on, 3, 2, 1, let's go. Up, slow on the way down. Fast up, 1, 2 seconds on the way down. Good, guys, this is our last exercise. Whew. Last one, and done. Give yourselves a pat on the back. Shake your body out. We're just going to do some stretches. So if you want to grab a drink of water, have a quick drink. All right, the first stretch we're going to do is our calf stretch. So against the wall, arms straight out. I want you to put one foot in front of the other, like so. Then you're just going to lean forward a little bit. So you should be feeling a stretch on your back leg. And we're just going to hold it here for a few seconds. So just focusing on your breathing, taking deep breaths in, deep breath out. All right, switching legs. So switching over. Leaning forward and pushing through your heels. All right, so we're going to go into our pec stretch. So just watching me for this one. I'm going to have one arm onto a wall, 90 degrees, and I'm going to turn my body away from the wall, so I should feel stretch along my pec. So if you guys want to find a wall to do this one on, arms up at 90 degrees, and you're just going to twist your body away from the wall, and you should feel a little bit of a stretch at your shoulder joint. So if you want to lean a little bit forward and twist away, looking over your shoulder, and we're just going to do a couple of deep breaths here, nice and easy. All right, can we do the other side now? So arm up on the wall, twisting away. All right, guys, from there, we're just going to do our lateral flexion. So coming back to the screen, we're going to do the little side dip. So this is our lateral flexion. I'm going to try and touch the side of my knees, coming back up. So just going to wherever you feel comfortable, slowly back up, side to side. Good, few more here. All right, and to finish off, we're going to do our twisting side to side. So as you do this one, arms are nice and loose by your side, and I'm looking over my right shoulder, looking over my left shoulder. Good, a few more. And all right, shake your body out. All right. That is EVO done. So if you have any questions, feel free. Let me know. Otherwise, I will see you guys on Thursday. Cool. How'd you go, Sabina?
Yeah, pretty good. But I did notice the second time we did the 360, 180, when I'm going anti-clockwise, I'm better going clockwise. I can do the 180 going all the way around. The first time I could do it. The second time, maybe I'm getting tired, but I couldn't get all the way around going anti-clockwise. So whether there's something to practice on.
It's something new. It's something we haven't done in this class.
I haven't, that's right, yeah.
So I would say it's a little bit of muscle fatigue, and we've done a lot of stomping today as well. So
Yeah.
Good job, Beatrice and Colin. If you want to unmute yourself, and then I can ask you how you go. All right. Do you have any questions for us, Beatrice and Colin? How did you guys go?
Yeah, I did that jumping turning badly, so I practiced that.
It was a new one, so
Yes.
we're going to be easy on ourselves today because we're all
Yes.
learning.
Yes, I have to practice that one. I really struggled.
Did you find the stomping okay?
Yes,
Well,
yeah.
I barely got going.
How did you go?
I found the arabesque was great for stretching the hamstrings.
Yes, it's a good stretch, isn't it?
Mm.
And it's nice to, like, I think with every exercise you can find a way that will challenge you that won't challenge someone else. So it's nice to find different variations of how someone does it. All right, well, I will see you guys Thursday for our next EVO class. So until then, have a great day.
Enjoy.
Bye.
Bye.
Yeah.